In this video, you'll see how acupuncture can help with stress, anxiety, and insomnia relief, and musculoskeletal issues, and digestion improvement, sleep improvement, nutrition improvement, and can even help with addiction. And you can also get all of these benefits from home. So check out the video.
Hey, we just had this amazing conversation. Jordan Larson, physical therapist.
Herb Kandel, acupuncturist phenomena in Santa Maria.
So we've been referring patients back and forth for years, and we have two interviews. One where I'm asking Jordan questions, learning about him, and
Yep, and then I get to talk to Herb, and we get to nerd out about some of the really fascinating aspects of what acupuncture does. Some surprising things about it. It's not just needles. There's a whole lot more to it. So it was really, really interesting, and I think a lot of people can benefit from understanding that. You know, we're in this strange time. People are stuck. These are some ways to get unstuck. Find some ways of even online sanctuary healing. That's really what I got out of this. So hope you check them out.
Check it out.
So you've created this sanctuary of healing, and so many of the things that you do are amazing. But I wanna know more. I have a selfish desire to have you tell me a little bit more, because I know that when I go to see you, I feel all this magic happening, and I have my Western brain which wants to analyze it in terms of a lot of times mechanical ways. But there's so much energy moving, and I would love to hear a little bit first about how you came to create that amazing culture in your office. What really floats your boat about what you're doing?
Jordan, thank you so much for the really generous introduction. And like you said, we've been colleagues across town and shared a lot of patients and share a lot of values. And there's a lot of similarity, I think, as I recognize in your practice, that same feeling of warmth and welcoming and energy flowing in there, and great staff. And through our conversation with patients, that becomes, as practitioners, that becomes our medium of communication. Like, you get to know really quickly the quality of someone's work when you refer a patient. And so I really appreciate the words, but there's mutual respect in our professionalism together. So, and we just had an interview where I got to interview you, so I got to know more about you, and that was really awesome today. And it inspired me to get out and go surfing if I can in the next couple of days, because that's what you did this morning. Yeah, just as far as the backstory goes, I look for a place of comfort and safety when I approach a health issue. For me, it feels a little scary and vulnerable to go to a doctor and a physician. I had sort of traumas as a kid that in Western medicine that were really, really difficult. And so when a child comes into my office, I'm thinking right away, like, this could be a foundational experience for them, and not necessarily just a child. It could be anybody of any age that is, feeling that sense of vulnerability. So we want to have several things going, like, we expect you, we know who you are, we welcome you, we want you to feel safe. I mean, for us to do our work, patients have to feel safe, and they have to feel heard. So I think that's the context, whether it's a physical therapist office, which you provide, acupuncture, Western medicine. So I think some of that, vigilance on my part of actually choosing a sanctuary space to practice in and to greet patients comes from my own experiences. And so many of the stories I've heard from patients as well. And I think that the reason I became interested in part in Chinese medicine, I was always interested in the natural world, as you are and your family is. I heard about all the pictures you guys take of hawks and stuff like that. So I've always been interested in the natural world, and that got me interested in plants and medicines, and had a chance to, very fortunate to have traveled much around the world and looked at different healing practices, realizing that there was a lot of wisdom outside. In addition to our Western medical culture, there's a lot of wisdom in other cultures as well. And ultimately ended up studying Chinese medicine and living and studying in China before I took my state boards here. For those that don't know about acupuncture, it's a California state licensure governed by the same, organizations that oversee physical therapists and podiatrists and physicians. And they set the curriculum and the standards and the studies. So the school includes, 40 to 50% Western medicine, and the rest is Chinese medicine, something like that. I mean, you're learning, and you have to have the same foundations to go into it. So once you get your license as an acupuncturist, you're actually licensed as a primary care provider. And that was the most generous license in California. And now it's been replicated in most of the states to some extent. So we can we can diagnose patients, and we can refer, we can order laboratory tests and imaging. Nice. And we are seen as a part of a team of practice. We prescribe natural medicine, supplements, and herbs, not pharmaceutical drugs. We do the procedure of acupuncture and other procedures like cupping, acupressure, exercise, as you prescribe. We learn Chinese exercises, and nutrition. So it's a holistic model that's using natural tools from a tradition that goes back thousands of years. It's evolved over time. It's not a fixed, ancient thing that's just frozen in time. Studies and changes have happened over time. But there are many foundation principles which I think are valuable to our culture that are part of Chinese medicine.
That's really great. And as you're saying all those words, and just to back up, you and I have shared our clients back and forth, and there's just we have a lot of history of seeing each other's clients, and one of the things that I really feel when I talk to your patients is how much more it is than just needles, how much more it is than just like the treatment, the treatment modalities that are happening. They're being managed, they're being heard, and that is something that I don't want to throw anybody under the bus, but there's just so little time in a standard, we'll just say a standard doctor's office. I read a study, and it was something like you have about 40 seconds to fully express yourself as a patient before the doctor is going to interrupt you and start quizzing or moving in a treatment direction. And so the feeling that I get when I talk to your clients is that they're being brought in, they're being listened to, and you're this amazing hub that, yes, has all of these treatment options. And I'd love to talk more about exactly what you do. You mentioned herbs, you mentioned, yes, there are the needles, there's acupressure, there's education, there's nutrition, there's all kinds of holistic management, and it's its own system that's this wonderful bridge between Eastern and Western, and in a mixing between them. But at the center of that is the patient, and that's what I feel when I talk to them about you. What would be some things that might surprise and maybe even delight people to know about what you help people with?
Well, first in China, being a practitioner for 35 years, you're just starting to get into the realm of, okay, he's got a little bit of experience. At 10 years, it's like you're a newbie. 20 years, it's like you think you know a lot, but really you're just getting started. Yeah. 30, 35 years, okay, we're starting to listen to him. But let's get, it's like opposite. They're just out of school. They just graduated. They must be the best doctor. It was the opposite in China. But, what you said before is a great in to talking about the diagnostic system. Mm-hmm. And so constitution, understanding the individual, is at the core of Chinese medicine. First, we're starting with who the patient is, and that directs the treatment. So all the modalities of acupuncture, herbal medicine, nutrition, exercise are going to come out of that. Diagnosis is really central to Chinese medicine, and it's kind of the most complex and maybe nerdy, and but it's actually the most important. It's because the choice of where you're going to put a needle isn't just about the physiology, what happens in the needle, which we could talk about, but it's really like, what's the intention of each of the interventions specific to the individual's constitution.
So what I'm hearing, thinking about this from a layperson's perspective or a patient's perspective too, is what that really sounds like to me is, if you've been given the, I'm gonna, if you've been given the runaround, if you've been dealing with something, say through Western medicine, we'll use your example of a headache. That's a perfect example. How many people I see that have headaches, and the doctors, they don't really know. And so these people have been through this treatment and that treatment and this medication and that medication. And so I'm really getting the sense that seeing someone like you would be a great place to be if you've had something that you've been dealing with for a while, and it just, it hasn't really gone away. Your style of diagnosis and assessment really opens up a whole other set of layers of opportunity for people to come up with a new solution, a more holistic solution for things all over the body: headaches, digestive issues, some things like that. What would you say are some of the most common certain things that you see more people for than others, as far as the symptoms and the challenges that they're having?
Absolutely. Yeah. I mean, I think we could start with just anxiety, stress, and insomnia.
Oh, wow. Oh, that's a big group of people.
If we talk about how acupuncture works, it's kind of easy to treat those. Of course, the treatment's always better when you get the story, and if there's counseling that's needed or other tools. But because acupuncture, is measurably increases endorphins in the body and serotonin in the body, and sort of manages, lowering cortisol levels almost automatically, and there's special points that do that. The use of people's experience with acupuncture, which, counterintuitive, right? Acupuncture, they're sterile, small filaments in select sites of the body that do not hurt when they go in. You barely feel them.
I know. And I know that. And I hear that one all the time. Like, oh, the needles. No,
they're filaments. They're very small. And I think people are relieved once this treatment starts, because any new practitioner, you're always nervous, but you get them in and it's like, oh, that's all? Yep, that's it. Yeah. But once that's happening, there's a sense of deep relaxation that's very unique and profound. And it actually is training the body. It's training the neurochemistry to upregulate those, much as, medicine tries to replace some of those, for example, antidepressant medication, keeping the serotonin circulating, or, a pain medication. So there's an increased, leaning now in terms of acupuncture. The National Institute of Health has new studies out. The Veterans Administration now emphasizes and covers acupuncture.
Right.
In the battlefield acupuncture, they were using that as during the Afghan War, as they were airlifting patients out to help begin the process of getting these severely injured soldiers off of opioids early, because they knew that had to do with their progress. It's like being able to get that out of them. They used the acupuncture points, ear acupuncture points, particularly on the outside of the ear. I have a slide of that. So that's one element of how acupuncture works for emotions and stress. And because those biochemistry has to do with some of the limbic cycle issues, you're also looking at deep stress and post-traumatic stresses. So I have most everybody comes in with some level of that, but some people, that's their chief complaint. And the second area would be musculoskeletal pain.
Yes.
Probably it's the largest percentage who I see. Yeah. And in that regard, and not to go into too much detail, but the insertion of the filament creates sort of capillary dilation in the area. So you're infusing local tissues with some of your own healing blood chemistry, and you're getting your immune system to work and break down scar tissue and infuse those areas for healing, like the sort of repetitive use injuries or back sprains or Sunday wheelbarrow injury, that kind of thing. But and so musculoskeletal injuries are also helped in part because that same pathway of the acupuncture transmits up the afferent nerve pathway to the spinal cord and influences a whole dermatome. So you could put a needle in this point. Let's say the pain let's just say it's a lateral epicondylitis, from gardening or for tennis or something like that, tennis elbow. Yeah. So you might put a point here. You might do some local points with some electrostim, and then you might be doing an ear reflex point for the elbow area. So you've got local tissue, which you can kind of understand the circulation from the acupuncture, right? Because the body's strong immune response says, oh, there's an invader, but there's no damage. But we're going to put a lot of tension on this area. So tendons not well circulated are going to get nourished differently. But the distal points here, running through that area, influence the dermatome, which influences the whole segment of the arm. And that's useful not only for the local pain and tissue healing, but also for repatterning habits, which is your area of work. You can get somebody to be thinking about their posture and their utilization of the computer in different ways when you've made some systemic changes as well. And the ear points could help with associated problems like the inflammation and pain and stresses that might be associated with that. So that's just a small example of how you might use acupuncture in a musculoskeletal way. You could apply that also to the back or a leg or a knee injury.
Well, that's a huge group of people. I mean, you just mentioned two main things: stress and anxiety as one group, and musculoskeletal pain as another group. I mean, that's basically everybody on the planet, right there. So that's really true. And I know that so I guess the gears are turning in my mind when a lot of times when people come to see me, I know that they've got musculoskeletal pain, and sometimes I refer people to you when they're just in too much pain. I can't touch them. I can't do anything with them. Those are really great candidates for seeing you, because the treatment that you do creates such a systemic calming for them. And also the thing that I'm hearing is that when people come and see you, say they're coming in for a musculoskeletal thing, they don't even really think about the anxiety or the stress, but they're going to get a double benefit of not just helping their musculoskeletal pain, but just by the fact that those needles are going in, it's creating endorphins in the body. So there's going to be an improvement in stress and in anxiety as a side effect. And just the fact that some people see you with such great results just for not just for anxiety and stress, because that's a huge thing, but thinking, oh, I'm gonna, so it could go either way. It can be musculoskeletal, it can be anxiety and relief, and it's probably going to be both.
Yeah, I think most of us go to the doctor or clinician because we have a singular issue. That's what drives us.
Yeah.
What's unique in the case history is that we get the chief information, but I spend a lot of time to get contextual information. So like, okay, so the tennis elbow is the worst thing, but you didn't mention it, but you also have chronic back pain, right. A knee replacement surgery that still gives you some problem, right. Snoring and sleep apnea, and some gastric reflux, right? So we get all that information. Yeah. We may focus on this issue, but we're going to attend to other points and maybe even make prescriptions and suggestions that are going to help the other areas. And so more and more people are coming in actually not as a last resort. I think in my early part of the practice, because acupuncture was less known, it was more like, okay, I've tried everything else, so now I'm going to try you. I don't know how it works or if it works, but we're going to give that a go. And now that acupuncture is pretty well known and Chinese medicine is popular throughout, and there's a body of science, or let's say a body of clinical experience among patients, people are now coming in and saying, I'm here because I have a few nagging problems, but I really want to generally get healthier. I want to talk about nutrition. I want to change some habits in terms of, addictions is another area that acupuncture helps with, compulsion and addictions. And that can be food addictions, substance abuse addictions, overwork addiction, whatever. Yeah. So people will come in for general health now more than they did in the past. And those are the patients that I have for years, and their kids and their grandkids, yes, I'm that old, but, and I have the joy of getting to know families over time, and you get to know them well. So for patients, it's a comfort because they don't have to start from scratch when they come in, and they know they can be addressing a number of different things. That being said, referral is key, because, I know my limits. There are limits to what these tools can do. I have a patient who comes in, and I remember her walking down the hall, and she was shifting toward the hallway, didn't even know she was. She'd been a patient for a very, very long time of mine. And I had her, I had her to her GP the next day and to her neurologist by the end of the week, and they were working on the brain tumor. Acupuncture is not going to work on infectious disease. There's acute injuries and fractures. There's post-surgical recovery that requires PT first. So being part of the team and knowing our limits is really important too. We're not in silos, we're interconnected. We're stronger because of that connection with each other as practitioners.
Yeah, and then again, that really speaks to how I observe our mutual clients, the ones that have been working with you, and it really is that hub, and you're at the patient is at the center, and then you're providing quite a bit of different types of services for different angles, and that's that holistic model that I really subscribe to, as well as a physical therapist. So often we get people referred for shoulder pain, and so in a typical PT place, I hate to say it, but it's like that's all they're going to touch. They're not even necessarily going to go into the neck, and I won't nerd out on why that's an issue, but we're going to look at their feet, because we're going to look at their neck, because everything's consistent and connected when you put your foot on the ground. Everything changes up the whole chain. So and that's just on a mechanical level. You're not only looking at it on just the mechanical level, you're looking at on all those other dietary and emotional and systemic and energetic things. And then sometimes, you need to refer out. And so that's when we get to work with some of your patients. Yay. And then, like you're saying, sometimes it's no, this isn't something this is something that needs to go to the GP and the neurologist, but you're there for people. At the heart of all that, you're there for people. And then so they have this solid rock of a place to go. And so you're right, it's not just like this last ditch effort. It's perfect for people that are already well to see you, to maximize that longevity, and to maybe even create wellness in other parts of their worlds that they didn't even know about, as far as anxiety and stress and digestion and so many different things too.
For some people that's the key, but for many of us too, we go in for a targeted thing. We may build a long-term relationship, but I might see a patient once every 3 years because of an injury. It's not necessarily a model that says you have to be getting treatment all the time. I wanted to share a little bit about we're in this unique time of kind of the COVID-19, the quarantine issue.
Yes.
Looking at unique options of delivery that are going to give safety to people. Some really unique options among other acupuncturists that I've learned from, including possibly using the outdoor garden, with a heat lamp outside, because we know how much safer it is to be outside, create a nice warm environment with heat lamps on this beautiful lawn in the outdoor garden, using one room with, one patient at a time, sterilization of the room, air filters, and many different aspects down to every surface that's touched. So this will be changed. It needs to be changed. We need to think differently as practitioners from a safety point of view. It also gives us a sense of priority in terms of, who are the patients at risk and who do we really need to see now.
And just to interject, at the time of this recording, we're 2 some odd months into this. So it's what, late May right now.
Right.
In that time. So that's where our brains are right now. If you're watching this at a later time, this is a little glimpse in time as we start to think about how to come out of this. And so, things may change. Things are changing weekly as we go through this.
But it is changing, isn't it? And that's challenged us to be creative. And, for me, suddenly, it was going to be calls to patients, because they're like my congregation, they're like my family, they're like, friends, people I care about. I'm invested in their stories. So I was, right from the first day of closure, on the Monday that when we closed, I was on the phone and working, every day for weeks, calling, and then using telemedicine. The first thing we did was, of course, being able to understand that the diagnosis can happen through visual cues. like we do facial diagnosis, we do tongue diagnosis.
Yeah, a lot of people don't understand how much you can do just through what you see and how you're observing them in front. And just to clarify too, these are telehealth services that you're offering now that people can do from
Right.
the
That's
privacy
right.
of their own home, and they're at home and they're suffering from something. And now though, there's these services that you can offer, and I'd love to hear more about what you do.
Right. So, I've often put in these ear press points. Maybe I'll do a screen share to share a couple pictures at this. So there's these things called ear press points that, let's see if it's going to load that. Give it a
I love
second here.
I love
There we
how
go.
half the pictures on that are of dogs and animals.
Yeah, there we go. Yeah,
Yeah.
you're going to say, I was going to get to that.
Yeah.
But so these are small little acupressure points that are used on the body or the ear, and it's a piece of tape with about 6 millimeter needle in there. And let's see if I can get to another picture. And then I can identify to a patient, here's a point. So I'm showing them on a model.
Yeah.
In some cases, I would show them on my own body where the point is.
Yeah.
And then they would apply this little tape with a small 6 millimeter point there under my supervision, sterilize, insert, no pain whatsoever.
Well, that's fascinating. So they can actually apply a little bit of gentle, really, really small filament of
Yes,
acupuncture on themselves at home.
that's right.
Oh, that's fascinating.
Yeah, and so there's the point. I don't know that you can see it.
It's teeny.
Let's
Yeah.
see. Yeah, it would be hard to zoom into it, but it's very, very, very small.
You can see. Yeah.
Yeah. And so these are. That's not what we wanted on that one. Let's see. Let's go back to this here. See what more we can find. This was the motivation for us to be cautious. I love the model because it
A little side note is Herb and I are both surfers, and so here we go with the flattening the curve of the COVID virus infographic based on surfing. My favorite part is the shelter in place in the blue with the little character in the middle of a tube.
Isn't it perfect? It's just great. Yeah. And so here's the ear point, just kind of shows. So I might have a patient, this particular point called Shen Men that translates to calm gate is a very great point for deep relaxation. And each of those regions relates to a different organ in the body.
So that's a picture. It looks so that's
an ear.
An ear, and so number 80 is that point, and you.
That's right. Thank you.
Them just to put it right on that spot.
Yep. And let's see what else we can find here. I was going to another. I'm going to come back to that to see where we're. So then here's a screenshot, and this patient gave me permission. So I'm educating. This is a woman who's working on her husband.
Yeah.
And he has low back pain. So we were identifying where the areas of pain were. And what's neat about this is, patients taking responsibility, both for themselves and in their families for care. Yeah. And this has been just amazing thing to see.
Yes.
Because they get a sense of pride, they get a sense of accomplishment, and they are also equipped to care for each other in the long run,
yeah, go ahead.
Yeah. And then the other exciting things are animals that come into the screen. This was just one of the patient's dogs that came in yesterday. I had a cat that kept walking back through and, kind of rubbing her tail on the screen.
And speaking of animals that come into the screen, I've been watching your videos, your Qigong, your Tai Chi videos of movement in your yard you've been putting together. And we'll link to these in the bottom too of your YouTube channel. Really, really wonderful routines of just bringing energy through the body. And in one of them, your horse Kai comes up, because they're out in your backyard. Your horse Kai comes up and starts giving you kisses from behind, and it was so cool just to see just how you mentioned that some of it was that they hadn't been fed, but I could tell it was more than that. There was definitely a connection there, and it was really, really cool to see that.
Yeah, I think another benefit of sheltering at home and practicing from home too is that we have that connection to our gardens, to our animals.
Yeah,
I'm seeing that with my patients, and sharing that in the videos. So there's been self-care instruction, um, but also the opportunity to do education. I teach at this community college. So this is an acupressure workshop that I taught to PCPA students, and they are learning how to apply acupressure to themselves, and what those points are for.
Yeah.
Having learned that, then you're equipped for, stress reduction, acute pain relief, headache treatments. And so that's been really exciting for me as a practitioner to say, wow, if I spend not just all my time doing the work for them, but putting together these slideshows and programs, which I actually have on my website now and on Facebook, they're available.
Cool.
It's been fun, and so the teaching and the collaboration and just the irony of this is I was using this at a higher level to get the right angle for the workshop I was teaching of it. And of course, I just wanted to show you the game that's at the bottom of the pile.
Yeah.
So
I noticed that.
yeah. So I think that's pretty much it on the screen share shots, but just cool. A few to show. The other thing we've been able to teach is cupping. That they're silicone cups that are very easy, safe to learn at home. And once you learn how to work on yourself or work on your spouse, then you can do a lot of treatment at home too.
It's amazing how much stuff is available. And we this is actually our second interview, and in the first one I was sharing, because we're also doing some telehealth in our office, and treating patients, and just seeing how much we can see when I can see them moving their bodies, or like your video was showing a wife or a spouse or a loved one doing some acupressure points, and so in that scenario, it's like, it's loved ones helping each other, and then also just individuals helping each other. I can't have them just flop down and then be passive. You can't have them just flop down and just get the needles. Them finding some self-treatment, them finding some self-management, them kind of taking, and we're tempted to say, take ownership of their thing. But when you're a person suffering from it, it's more about empowerment. It's more like, oh, I don't actually just need someone to do this thing to me. I can find oftentimes some very simple things to do, like those acupressure points, or a finger point, pressure point, or something along like that. What I see from my clients too is that they feel like they're not stuck anymore, and that they are moving forward. They're not just stuck at home. And actually this reminds me of another thing that I wanted to ask you about. When I, as a non-informed, as a layperson in terms of acupuncture, the way I describe acupuncture to people is that disease is caused by stagnation. And that can be true for so many things. There's, our breathing. If we stop breathing, we die. If circulation, if we stop moving our blood, we die. And on down to smaller movements. And so the way I describe acupuncture is it moves energy through the body. It does it in unique and different ways than, say, even just a massage or just exercise. Do you think that that's true, that stagnation is the cause of a lot of issue, and that acupuncture moves energy through the body? Is that fair to say?
Yeah, I mean, I think it's very similar to what you do as well. There's, rusty hinge doesn't move, so the movement, the mechanical movement isn't just the movement of the muscle. There's also neurological supply that happens there. There's the biochemistry that happens in the brain. What does exercise do for us in a way? What does just routine moving, walking? It definitely, to the emotions, right? You see the emotion changes. So Chinese medicine looked at the whole matrix of those connections in its description of the basic stuff of life, whereas the West went with the particle, to say that what's real is something hard like a brick, or a cell. And Chinese medicine went with the wave, so to speak. And we know in physics that reality is particles and waves. Yep. So they're talking about the interconnection, the interlacing of all those functions of physiology, the biochemistry, the emotions, intentions, inflammation, pain, blah, 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 is sort of connected through this network of energy. And acupuncture points is really about regulating and balancing and moving that energy around. And that's sounding more scientific as we're discovering subtle energy flows
Yeah.
within fascial tissues. And
Yeah.
there's a neat, another interview that we should do just on this topic. But there's amazing research about networks that are connected: immune system, physiology, um, endocrine system, through subtle measurable electrical flows, not through the nervous system, but through fascial planes that are very much the acupuncture meridians. So it's a fascinating area that helps us understand how Chinese medicine has viewed the body differently.
It seems to me like the what's happening is Western medicine is just finally catching up and having the words and the testing measures to understand what Eastern medicine has known for a long time.
Yeah, there's so much to learn, and what excites me is actually the collaboration. Like, I love digging into the Western science
Yeah.
as well, fortunately, I picked a career that the science keeps saying yes
Yeah.
to most of the features. It's like, oh, that was a dead end career. I was like, no, it seems like there's new information that's supporting it,
Yeah.
and that's supported also by insurance companies covering, the military government using it, criminal justice system using it for addiction recovery. Through clinical experience, but.
Yeah.
But I kind of wanted to, I know we're getting close to wrap up time,
Yep.
to say that, what we've learned through this experience that we're in now, kind of hopefully the tail end, and there won't be another resurgence. Um, Patients also have been challenged with this sense of being creative about their health. And many of the patients I've talked to have had these epiphanies. One, I remember the first week, she said, I don't have to go to any more meetings. She's on every nonprofit board and volunteering everywhere, and she was so relieved. Other patients who've had chronic issues are walking their dog every day. They're taking online yoga classes. They're spending their time eating better. And so my question is, how are we going to take what we've learned as practitioners and as patients into the next phase, into coming back into getting in our cars and being busier and going about? We need to take the caution with us, because the world's changed and it's not back to normal. That's so important, that safety. But second, what is the internal messages that we're going to take forward, and one thing I know, it's having conversations like this, with friends like you, and collaborations, and taking the space and time with patients, and then keeping some of those inner reflections that we were all challenged to have with different circumstances. I've likened it in the compost, like we want to keep that process composting, right? We need to keep watering it and keep it so it's still processing. It doesn't dry out. It was like, what was it that we learned then? I don't remember. I'm just back to, no, we want to keep that alive.
Yes.
So I'm really grateful that you took the time to ask questions and hang out together talking.
Yeah, my pleasure, and it's been great having you on here too. And I think that along those same lines of just we're in a new place. For many, they are stuck. There's a lot of people that are stuck. For some people, they're actually having epiphanies about a new way of doing things. A lot of it is honestly, in my experience with my clients, is they're finding ways of being a little gentler with themselves, and finally taking some time for themselves. So I think that for the people that aren't stuck, this is an encouragement to continue doing what you're doing and keep investigating those things that just feel good, that help you stay in flow, that are intuitively and even objectively right for you. Great, keep doing that. And for some people that are stuck, I'm hoping that this video is also letting you know not just that there's in-person things are going to be happening again, but even right now at this very moment today, there's ways of getting help. And some of that is telehealth. And some of it is just checking in with us. I know that you're generous with your time and checking in with people. I know you've been calling your clients, and I know that I've been too. So I'm sure that I know that I'm happy to talk to any of your clients, just no charge, just to check in, kind of do a phone screening just to see what's possible. And you may have something similar too.
Absolutely. Yeah. It's, I have more time these days, and
Yeah, these
I'm
days, yeah.
making a commitment to try to keep that space open too. And yes, absolutely. You know, I when people call with questions, it's important that you.
Well, the appreciation is mutual, Herb. Thanks so much for spending time. And I'm also happy to hear that, you know, with Western science coming in and really supporting what you're doing with acupuncture in all those ways, and the VA covering it, and certain insurances are covering it too. So sometimes there is some financial coverage of your services. At the same time, I just know personally how much, and professionally how much, even spending some financial resources is such a wise investment. You know, with times like this where health is at a forefront of our minds, what better thing to invest in than our health, so that we stay strong and live lives in a happy, peaceful, flowing way.
Well said.
All right.
Thanks again.
My friend, we'll talk soon. We'll nerd out on another video, and we'll talk about the fascia next time.
Let's do that. Take care.
Bye. That'll be a good outro. You want to see Herb push horse up a ramp with a wheelbarrow? We've got the video for you.